Hi, everybody. I'm Russell Vinik. I'm Medical Director for GBS Benefits, and today we're going to talk about aspirin and cardiovascular prevention. So, one of the common scenarios I run into when I see patients and talk about their medications is they say, well, I take an aspirin a day. And I ask them, did the doctor tell you to? And they're like, no, it's good for me, right? It's just a baby aspirin. It won't hurt. And that's a really common misconception that aspirin is a benign drug. And so I really want to spend a bit of time talking about the benefits and risks of aspirin. So, as an overview, we're going to talk about cardiovascular prevention, benefits of aspirin, the risks of aspirin, and really who should be treated with aspirin. So first of all, when we talk about cardiovascular disease, we talk about primary prevention and secondary prevention. So starting with secondary prevention is essentially preventing a heart attack or stroke in somebody who's already had a heart attack or stroke. So these are people that are at high risk, knowing that they've already had one cardiovascular event. And if I were to summarize all the trials on aspirin, aspirin reduces that risk of a second event by about 22%. And that's why just about everybody who's had a heart attack or stroke should be on low dose aspirin, 81 milligrams a day, which is a baby aspirin dose, or some alternative. And there's a lot of reasons we're not going to go into why sometimes we use alternatives like clopidogrel, which is Plavix, or Brilinta. In some cases, particularly people with cardiac stents, they often require dual antiplatelet therapy, like aspirin plus clopidogrel, for a year or longer. But we're not going to go into detail on those. What I want to talk about more is primary prevention. And so these, by definition, are people who have not had a previous heart attack or stroke. And so if I summarize all the trials again, aspirin reduces the risk of heart attack or stroke in primary prevention by about 12%. So nothing huge, but real and statistically significant. So let's talk a little bit about the risks, though. So the risks of aspirin increases major bleeding by about 50%, even when it's given with low dose. Um, when we talk about major bleeding, this is generally bleeding that gets you into the hospital, requires a blood transfusion, bleeding into a critical organ, your brain. GI bleeding is the most common. Um, Now, not everyone has the same risk of major bleeding. So age greater than 60, male sex, hypertension. And the reason I have those highlighted in red is they're also risk factors for cardiovascular events. So we have to really be careful with our balance here. Other risk factors for bleeding include other medications, like blood thinners, anti-inflammatories, and steroids. Certainly, anybody who's had a bleeding problem in the past is likely to have problems with aspirin. And then the dose of aspirin. The higher the dose of aspirin, the higher the risk, though the benefit does not really go up with higher dose. And this is why any guidelines that recommend aspirin generally recommend low dose aspirin. Baby aspirin, once again, 81 milligrams. So let's look at just kind of putting this all together. And this is a meta-analysis. So basically a study on studies. So it looked at 11 different studies with about 133,000 patients. And this is heavily what the guidelines relied on this study in making their most recent 2022 guidelines. So what you see is, as far as cardiovascular events, there was a small but generally statistically significant. So if those lines do not cross 1, then it's considered statistically significant. So a small but generally significant reduction in cardiovascular events. But I've highlighted what's most important to us, which is all-cause mortality, because If you prevent a cardiac event, but somebody dies from bleeding, you haven't done much good. So looking at all-cause mortality, you can see the benefit is even smaller, and it actually does not reach statistical significance because the confidence interval crosses 1. So that is the benefits of aspirin from a cardiac perspective. There's also a lot of data back and forth about colorectal cancer. Is it beneficial? Is it not? You can see that studies go both ways. So as a general rule, aspirin for colorectal cancer, probably not beneficial unless someone has exceedingly high risk. But on the other side, harms are very clear. Total major bleeding, a relative risk of 1.44. So that's about a 45% risk higher of major bleeding. Bleeding in the GI tract, over 50% higher. And then bleeding in the brain, 20 to 30% higher. So that is not insignificant and very concerning. So this makes it a bit harder because guidelines have changed over time. And the most recent guidelines, which take into account the more recent data, and part of the reason why this is important is the benefits of aspirin are not as good as they were 20 or so years ago because we have so many other great treatments to reduce people's cardiovascular risk, like really good cholesterol treatments, really good blood pressure medicines. So the benefit of aspirin has actually changed over time as our cardiovascular treatments have improved. So the most recent guidelines recommend only consider aspirin in people age 40 to 59 who have a 10% or greater risk of a coronary event. And even then, the USPTF recommends that this be an individualized discussion of benefits and risks. Now, what's also very different from the past is USPSTF recommends not initiating statin for primary prevention in people who are age 60 or greater. So how do you know if you've got that 10% or greater risk? Well, we've talked about this in the past with cholesterol, but there's an online ASCVD calculator where you can input variables including your age, gender, cholesterol, blood pressure, smoking, diabetes status, and it will tell you your risk. So just summarizing all of this together, aspirin's a drug. It causes significant harm. Most of us believe that if aspirin came out today, it would not be available over the counter, but it's been around so long that it is an over-the-counter drug. There's a lot of other interventions, including lifestyle intervention, blood pressure management, cholesterol management, that actually have a better benefit to risk profile than aspirin. So the decision to start aspirin treatment should be individualized and discussed with your healthcare provider, as should the decision to stop aspirin if you're currently on it. So I really appreciate you taking time to be with me today. My name's Russell Vinik, Medical Director of GBS Benefits. Thank you again for joining us.